Hi, this is Emily Brown's health assessment video with my patient Megan Toomey. So we're just going to start with some family history. Hi, I'll be your nurse today. My name is Emily. Can I ask you a few questions before we start? Have you had any past family history of respiratory disease or anything that you know about?
No.
No. Okay. Have you been experiencing shortness of breath or
No.
chest pain?
Mm-mm.
Do you smoke?
No, I don't smoke.
Are you around any smoke, secondhand smoke with
No.
your family? No.
Mm-mm.
And do you think that where you live is okay? Do you live in the city with a lot of pollution? Or?
I mean, I live in the city, but I'm not exposed to that much pollution.
Okay, so no environmental hazards or anything?
Mm-mm.
Okay, that sounds pretty good. We'll get started. Okay, Megan, we're going to start your assessment by doing shape and configuration. If you could just stand over here with me. I'm just going to check your costal angle right here. It should be 90 degrees. And it looks pretty good. And then we're going to look at the ratio of anterior to posterior. Measuring here, checking in the front, and it's about 1 to 2, which is perfect. Okay, Megan, I have to say your posture looks great. You're not leaning over or anything. I'm going to check your skin really quick. Just, feeling around for any rashes or rough patches. And you look like you have good color. It's not blue.
Mm-hmm.
No clubbing on your nails. Fantastic. Now I'm going to ask you to turn around really quick because I'm going to do a symmetric expansion test. So, can you breathe in for me? Very good. Okay, turn around. And one more time. Alright, perfect. Okay, next, Megan, we're going to check for your tactile phlebitis. And I'm going to start with the posterior. Sure. Turn around. I'm just going to ask you to say 99, pretty loud, when I'm palpating your lung areas. Alright, go ahead. 99. 99. 99. 99. 99. Okay, turn around. 99. 99. 99. 99. 99. Okay, good. Okay, Megan, next we're going to percuss your lung fields, which means I'm basically just going to check for any dullness that I hear. So we're going to do the back first. Alright. Okay, that's pretty good. And the front. One more. Okay, we're good. Next, Megan, part of the assessment, I need to just listen to your lungs right now. So just breathe in and out when I tell you to. Okay. Let's start with the back. Okay. Breathe in. Okay, and the front. Okay, it's the same thing. last one. Okay, that all looks pretty clear. And normally we would ask you to wear a hospital robe or take, off your shirt, but for video reasons. Next, Megan, I'm just going to ask you a couple questions concerning the heart, the cardiovascular system, about your family. Are your grandparents still alive?
Both of my grandfathers are.
Okay, your
Yeah,
grandmas?
both my grandmas have died.
Okay. Do you know what they died of?
Yeah, my one grandma died of lung cancer, and then the other one of dementia. So.
Okay, so nothing related to the heart that you know
No.
of. Any high blood pressure in your family?
Both my mom and my dad have high blood pressure.
Okay. Cholesterol?
I believe they both have high cholesterol as well.
Okay, that's fine. It's normal. And what about diabetes?
No, but
Okay, that's really good. All right, thank you. That's all. Now that the questions are over, I'm gonna check your capillary refill, which basically just let the blood flow. Okay. Just press down, and it should fill in less than 3 seconds. Looks good. Do it one more time on this hand. If I was concerned, I would look at your feet. But you have toenail polish on, would be a little tough. But they look good too. All right, next I'm gonna palpate your carotid artery, only one at a time. Pulse is steady, strong. About a 2 on the scale. And I feel like your veins are elastic too. Alright, so now if I would feel or hear any abnormalities, I would check. I'm just gonna listen anyway with the bell. Good. I hear swishing, no tinkling or any weird sounds, crackles or anything, so that's good. Check for your other pulses, starting with radial, and then brachial is up here. Femoral is in the groin area. I'm not sure what's right now. This is the popliteal, the dorsalis pedis, which is a very light touch, and then going back to the posterior to the O2. All right, looks good. Megan, I'm gonna have you lay down with your left arm up on your left side. And basically, what this is checking for is to feel your apical impulse, which is the point of maximum impulse. So I'm just going to check down here. It's at the 5th intercostal space, mid-clavicular line. Sometimes that's a little hard to draw. Okay, good, nice and strong and steady. It's where it should be. So we're going to listen to your heart sounds. I'm going to start in the aortic, which is 2nd intercostal space, right sternal border. And this is where you hear S2, which is the dub. Then we're going to go to pulmonic, which is the 2nd intercostal space, left sternal border. And we move down to the tricuspid, which is 4th intercostal space, left sternal border. And last, we go to the mitral, which is the 5th intercostal space, mid-clavicular line. And this is where you hear the S1 or the lub. And I don't hear any murmurs, so you're good. Megan, we're moving on to the abdominal assessment, so if I could just ask you a few questions concerning, do you have any troubles with your appetite, or how's your appetite been?
It's been fine. I'm pretty regularly with 3 meals a day or
Okay.
more.
Difficulty swallowing with any food? No? Do you have any food allergies or intolerance to types of food?
No, usually the food is everything's fine.
Okay. And last of all, are you taking any medications for any bowels or anything?
No.
Okay. Continuing the abdominal assessment, I'm looking for the contour of the abdomen, which is pretty flat. Symmetry, there's no bulges or tumors or anything. And I'm looking at her belly button, which isn't any. And there's no redness or cyanosis around it. And last of all, her skin is fair. There's no rashes. It's smooth. It's warm. It's there's no bruising or incisions of past like surgeries or stretch marks. So she's going to auscultate or listen to the bowel sounds starting in the right lower quadrant where the bowel sounds will normally be heard the most, from 5 to 30 times a minute. And move clockwise to the left. They sound pretty normal. And if they weren't normal, I would keep the stethoscope there for at least 5 minutes to check. I'm going to percuss the abdominal sounds and the bowel sounds, starting in the right lower quadrant, going in a Christmas tree-like pattern, checking for dullness or hyperresonance. But usually you'll hear timpani, which is what you want to hear. There's no masses. So I think she's good. Palpate the abdominal areas, and we're going to do it really lightly. So we're checking for tenderness in a circular motion or masses. I shouldn't be able to feel any organs during this. Next, we're going to go deeper, which is about 5 to 8 centimeters. I should not feel the spleen. If I do, it's because it's enlarged. So I feel no tumors or masses or any tenderness. We're going to palpate for her liver. And what we do for that is I'm going to stand on this side and I'm going to use the hooking technique, which is like grabbing under the ribs. And I'm asking her to breathe in now. And I should be able to feel the edge of the liver, which I do, which is good. And now for the spleen. I should not be able to feel that. She's good, it's normal. I'm checking for kidney tenderness, starting in the right lower quadrant. I'm going to put my hand on her posterior side. And then with a duck bill, I'm just kind of pressing for tenderness, which she's not reacting, so she's probably not that tender. And over here on the left, and I don't feel any masses, and it's not enlarged or anything, and no tenderness. Last on our list, we're checking for rebound tenderness. Basically, if she had pain in one of the quadrants, I would pick the opposite one to test on. And I go down at a 90-degree angle. So we're going to do the right if she had pain in the left. So we go down slowly and deep, but we lift up quick. And if she didn't feel any pain, I don't think she did. Nope, then we're good. She doesn't have any tenderness or severe pain. Going back to palpating the organs, it's important for your patient to bend their knees to relax in between or whenever you feel necessary. And that concludes the assessment on the lungs, cardiovascular system, and abdominal. Thank you.